the Maryland Department of Health and Mental Hygiene Hospital Breastfeeding Policy Maternity Staff Training Program, assuring that your hospital is supportive of breastfeeding, Session 15. Objectives. The purpose of this final session is to assure that you understand the process and reasons behind each of the steps that actively support women in their breastfeeding goals. You have now received a lot of information about how you can help a breastfeeding family as they learn to breastfeed. Studies have shown that early post-birth management of mother-infant care influences the dyad's success in reaching breastfeeding goals. The steps discussed, which we will review during this module, have been shown through evidence-based research to improve breastfeeding outcomes. It has further been shown that even fulfilling just 6 of the 10 steps improves breastfeeding success rates of your patients. Hospitals achieving baby-friendly certification are audited to assure that all staff are following the steps that support breastfeeding families. During the audit, any hospital employee could be asked questions regarding the meaning and importance of baby-friendly and its components. After achieving certification, audits continue to occur to maintain the baby-friendly status. Not every hospital is certified baby-friendly. Those certified have achieved a level of breastfeeding support that is recognized worldwide as the optimum level of mother-baby care with regards to infant feeding. Hospitals that show they are fulfilling the 10 steps are able to obtain the baby-friendly certification. In 2014, more than 21,000 hospitals have already achieved this certification worldwide. Unfortunately, the United States is lagging behind, with less than 200 hospitals nationally and few achieving this status in Maryland. By following the Maryland Hospital Breastfeeding Policy, all hospitals in Maryland will be one step closer at supporting breastfeeding and improving breastfeeding outcomes. Look into the baby-friendly information to see how these numbers have changed by the time you are viewing this presentation. Let's take a look at the 10 steps, focusing on what an auditor might look for. We have already focused on the 10 steps. However, it is important to know what auditors will be looking for. Be sure you know where your hospital's breastfeeding policy is located, what is included, and where the 10 steps are displayed for the public. Understanding that training is provided to all staff who encounter mothers and babies, yet the amount of training varies depending on responsibilities. Obviously, primary care nurses working in areas such as maternity and pediatric units will need to complete the most detailed training, which equals at least 20 hours. Included in this training should be at least 5 hours of clinical experience. Some facilities may choose to provide this level of training to other staff, such as nursing techs or aides, who may also be working closely with mothers and babies. Physicians on staff at the hospital will need to complete at least 3 hours of breastfeeding education. Families make feeding choices prenatally, so it's important that they receive information at that time in order to make informed decisions. Baby-friendly facilities must provide this information through hospital-based prenatal clinics and have at least one source to offer for patients receiving care through non-affiliated prenatal practices. Education provided must include, at a minimum, information about the benefits of breastfeeding, the importance of exclusive breastfeeding for the first 6 months, and basic breastfeeding management practices. Step 4 focuses on getting the baby started immediately following birth. Babies should be placed skin to skin within 5 minutes of birth or as soon as mothers delivering by C-section are able to respond. Babies are to be left skin to skin, uninterrupted, until the completion of the first feeding. For those who have chosen not to breastfeed, babies should be left skin to skin for 1 hour. Earlier modules cover how to assist breastfeeding dyads. It is important that all mothers are shown how to position and latch their babies. Assistance should be provided as needed. Mothers should also be taught hand expression in case needed in the future to resolve a breastfeeding issue or to extract milk. Those with infants who are unable to fully nurse at the breast should be provided information and support regarding pumping and milk storage. Finally, mothers who have decided not to breastfeed should be individually educated about proper mixing and storage of infant formula. It is important that supplements to breastfeeding, which the evidence shows can prevent breastfeeding success, are given only if medically indicated. Of course, there will be times when mothers decide to do so without medical indication. Those feeding decisions should be discussed, and they must be informed about potential consequences of doing so. Their choice, after being informed, should then be documented. Any hospital materials given to families or displayed should be free of formula company advertising or suggestions that promote infant food or drink other than breast milk. Company logos and names remind the public of products they represent and imply healthcare endorsement, so they should also be avoided. Mothers and babies should room in together regardless of feeding preferences. Procedures, when able, should be done at the bedside. Separation up to 1 hour per day for medical procedures is also allowed if unable to be performed in the hospital room. Feeding cues should be pointed out to the mothers. Mothers should be taught to begin and end feedings based on their infant's feeding cues. Early use of bottles and pacifier nipples can interfere with breastfeeding. Encouraging the mother not to use these and to let the infant practice and perfect how to suckle on the breast will promote the best breastfeeding outcomes. If supplements are needed, it is encouraged that they be given by tube, syringe, spoon, or cup rather than an artificial nipple because these methods do not interfere with the infant's ability to learn to breastfeed. Check your hospital policy to see which alternative feeding methods are used at your facility. Learning to breastfeed takes more than the few days a mother and baby are hospitalized. It is imperative that the mother be told where they can get support once home. Some hospitals have their own breastfeeding support groups, while others refer mothers to community-based breastfeeding groups, local WIC programs, or other breastfeeding support services. Check to see what breastfeeding support is available for referral in your community. It is best that mothers receive additional breastfeeding support within 48 hours of hospital discharge. Take a moment to review this YouTube video to review the 10 steps.
I'd like to tell you about the handy reminders for the 10 steps. This is regarding the Baby Friendly Hospital Initiative, which is based on the 10 steps to successful breastfeeding. So I'm going to go through the 10 steps, and I'm going to give you a real easy way to remember the 10 steps by using your hands as cues. So we're going to start out with number 1, which is policy. And number 1 with policy is important to remember because policy points you in the direction you want to go. So number 1, hold up a number 1, point it in the direction you want to go, and that's policy. So number 2, you hold up like this. Number 2 is staff education. It's all about communicating what that policy is, about the skills that the nurses and staff need, and so it's all about communication, that back and forth. 3, if you hold up your left hand and turn it on the side, it looks like an E, and that's for prenatal education, which is step 3, prenatal education of our moms about breastfeeding. And then 4, if you hold up 4 like this, take it, rub it up and down your arm. That's the skin to skin. It's the skin to skin that's promoted in step 4 with that golden hour right after birth and throughout their stay. 5 is easy to remember. 5 is hand expression, so real easy to remember that one. The hand expression is important for our moms to be able to maintain their milk if they're separated from their babies during their stay and beyond their stay in the hospital. 6 is a bit interesting. You hold up a 5 and a 1, that makes a 6. Step 6 is exclusive breastfeeding. So take this hand and wrap it around and it becomes a breast. It's a little bit out there, but this is to promote exclusive breastfeeding, so we want to make sure to support that. 7, you hold up a 5 and a 2. 7 is rooming in, and so if you think of this as our couplet, the mom and baby, and we're going to keep them together. So wrap that 5 around and you get the step 7. And then for 8, I'm going to do 8 this way, 2 4 fingers on each side. And step 4 is breastfeeding on cue. And as we know, one of the cues for breastfeeding or wanting to feed is nibbling on your fingers. So bring that 8 up to your hands and nibble a little bit. That's step 4, breastfeeding on cue. And then 9 is no pacifiers. And so you hold up a 5 and a 4. Take the 4 over your hand, and the other one wave in front. No pacifiers. No pacifiers. And then step 10 is all about support groups, supporting the moms beyond the hospital stay. And so put your hands out like hug. We're just supporting those moms as they continue forward with exclusive breastfeeding beyond the hospital. And that's your handy reminders of the 10 steps to successful breastfeeding.
You have now completed the didactic portion of your breastfeeding training and should now have more knowledge of what you can do within your job to help breastfeeding mothers and babies succeed.